gay, bi, and other men who have sex with men experience the highest rate and proportion of new HIV diagnoses in Ontario. But because we know that so many people living with HIV are in Toronto, it obviously translates to the city. And so what we think we can do and bring together are rapid HIV and STI testing. And we do think we can do the STI testing more rapidly than has been done. The HIV tests, we already have the technology to do instant tests, so we'll continue with that. But we also want to be able to do PEP and PrEP prescriptions, which means that we would have some links to pharmacists or a pharmacy on site. Mental health assessments are a really big part of wellness, and we want to be able to offer that. So we're looking at building out an area for counseling. And then we also want to make sure that we have a team that can escort you and help you get to if you need other primary care. Maybe your issue is something that the doctors in that health hub can't help you with. So we would like to facilitate the transition. And then we're also thinking of some social programming. We know that people who come to Toronto or come to urban centers looking for community start with Grindr or start with sex. And a lot of that is because there aren't a lot of other options. And maybe if the community that we found wasn't sexual or right off, maybe there were other linkages, then it would change how people feel about themselves and how they interact with one another. And then the last one is training for healthcare providers. We think that a lot of healthcare providers, especially outside of the city, but even within the city, could use a little bit more understanding of what it's like to treat people, well, to treat gay men and to treat people living with HIV. And so there would be an opportunity for this hub to also train the trainer so that services outside of the hub could be improved. And so this would equal a welcoming space for gay men of all ages and ethnicities. And this would be a place that would be not stigmatizing, that wouldn't feel like you were going to a clinic, and would be open to gay men across the GTA.